start. So we're going to be speaking about e-prescribing today, and we'll give you some very nice industry intelligence on this topic and tell you what's going on, and also talk about some of the problems that e-prescribing is creating for pharmaceutical marketers, and as well some of the opportunities that are being opened up to pharmaceutical marketers. Although e-prescribing is growing by leaps and bounds, the real story is really its impact on pharmaceutical marketing. And it really concerns you, it affects you every day, and that's the message we're going to provide to you, the details of it, and some documentation, and I'm sure you'll find it very interesting. So we're going to talk about several things today. First of all, the overview of the developments, how e-prescribing has come to be the force it is now. And then Joel Auerbach is going to provide us the pair perspective about how he saw the growth of this, how he shepherded the growth of this throughout the last few years. And then I will talk about some of the findings we have from the Alliance project that we did on this topic, and also go into some of the warning signals that we are seeing for pharma marketers. So this is like an iceberg that is not being noticed, and we just want to get that message across. And then Art will give us a few conclusions, and then we'll open it up for Q&A. If there are any questions, we can take them at that time. So as we all know, e-prescribing has been growing by leaps and bounds. And in the last year, from 2011 to 2012, it grew by 25%. Now, as professionals, we know that very few things grow at 25% in real terms. But e-prescribing physicians have grown by that number. So this has become a pervasive trend, and we'll see more details of it. So again, by the end of 2012, 44% of prescriptions, so almost half the prescriptions, were sent electronically, and this is up from 36% in 2011. So this is like a galloping growth that we're seeing. And some of the experts we talked to say that we expect to see about 2 billion e-prescriptions by 2016. So there is no denying that e-prescribing has taken over, and we're going to see just more and more of it. It's going to grow by momentum, and because of some reasons that are coming into play, and we'll give you more clues into that as we go forward. Now, just to clarify, this data is not something we gathered. This is standard data from SureScripts, which is a very authenticated source for this data, and therefore we have full faith in these numbers. Now, going to the other side, going to the pharmacy side, we have, again, a huge penetration. 93% of community pharmacists are connected for e-prescribing, and of these, about 39,000 are chain outlets, and 19,000 are independents. So across the board, there is wide acceptance and usage of e-prescribing. And for those of you who are new to this field, this is how e-prescribing works. So as you can see, the prescriber is at the bottom. The prescriber sends the prescription electronically to the transaction hub. The transaction hub does maintain on its system a master patient index and routes the inquiries to PBMs. And the PBM, in turn, verifies the eligibility, the formulary status of the patient plan, patient's insurance, and the medication history. This information comes back to the transaction hub, goes to the prescriber, and at that point, as you will see later on, the prescriber has the opportunity to change the prescription to a lower price brand, and very often they do. So that is the problem. Then the prescriber sends the prescription back to the transaction hub, goes to the pharmacy, gets filled most often and most frequently, and comes back to the transaction status for advice to the physician, and the physician gets the message from the transaction hub, and the patient gets the prescription. So in brief, this is how it happens very quickly, and we'll see more details as we go forward. So as we heard a minute ago, this is creating major problems for pharmaceutical companies because when the physician signs on and when he puts the drug name in, he gets a message from the PBM or the payer that there is a cheaper alternative available, and the physician can switch the brand and go to a cheaper brand. Now that's a problem because you're losing control over the prescriptions, you're promoting like crazy, but the prescriptions are going away to competition because of lower price alternatives. And this the doctors are doing consciously and because of suggestions from PBM, so there is a problem. And just to save the hassles, the physicians are saying, let's go to the cheaper brand, let's change the drug, and the drug which was there written before, and the company that's the sponsor of the drug is the loser, and this is happening very frequently, and it's a major problem. On the other hand, there are several opportunities that e-prescribing opens up. For one, you can send advertisements through e-prescribing platforms to the physicians. So we know two brands, we've seen them actually when this happened, Lyrica and Xarelto, we've seen them advertising on e-prescribing platforms. And many of the e-prescribing platforms are integrated with the electronic health record platform, the EHR platform. So because of this, it's very convenient for the platform providers to send these advertisements. Now, the copay offset coupon vendors were quick to seize the opportunity here, and they started sending their copay offset coupons through the e-prescribing platforms to physicians. Physicians are very happy to receive them. They're using them frequently. They're attaching them to the prescriptions. Sometimes they get attached automatically, and this is quite a common practice, and it's of help to pharmaceutical companies. Also, sample vouchers are being sent to physicians, and they give them to the patients quite frequently, and e-prescribing platform is another vehicle through which this is happening. Also, it has been reported back to us that because the prescription goes directly to the pharmacy, the persistency increases, and they're seeing more compliance, more persistency with prescriptions because of e-prescribing. And based on the recent reports we've gotten, you have PBMs like Caremark and a couple others joining in who began to provide electronic prior authorization of specialty products. So this is a big stumbling block in the past, but now even specialty products can be prescribed quite easily over the prescribing platform because the prior authorization is aided by the software that is installed for that purpose. So what's really happening here is there is a behind-the-scene battle going on between drug marketers and PBMs. And at this time, unfortunately, the PBMs are getting more and more control of the territory, and this is something we want you to be aware of. We feel that the threat of e-prescribing is not fully appreciated, or sometimes maybe it's just convenient not to face it, but nevertheless, prescriptions are being lost because of that. So at this point, I'm going to turn the presentation over to my colleague Joel Auerbach, and he will take you through the next steps. Joel?
Okay, thank you, Dilip. Wanted to talk a bit about the drivers for e-prescribing, and there are many of them, and they continue to grow. Some of the initial drivers are really the financial incentives, and we'll see shortly really coming in the late 2000s through MIPA and then high tech. And part of this was both a carrot and a stick approach. First, there would be a financial incentive to do e-prescribing, and each year with slightly more qualifications for what it meant to do meaningful use e-prescribing, and eventually leading to threats. We also found that improvements in the electronic health records and electronic medical records also was a driver for this, as many offices and particularly physician practices that were being bought and incorporated into large hospital-owned practices were then becoming part of a larger EMR system, which includes electronic prescribing. Early on in the early to mid-2000s, it was not uncommon for insurance companies, and particularly Blue Cross Blue Shield plans, to be on the forefront of helping to fund pilot projects where they would either install systems or pay, in some cases, several $1,000s a year for a physician to adopt an e-prescribing system. We've certainly seen where, well, not only has this helped, but as we see the overall transformations taking place in healthcare with the advent of medical home, accountable care organizations, and certainly a new focus on quality, we're also seeing that e-prescribing as an integral part of an electronic medical record is becoming a requirement. So, for example, medical homes now, to participate in a medical home project, you have to be connected electronically with an EMR and be doing electronic prescribing. I would expect the same with accountable care organizations, as it's critical to have all this this particular data. And we're also seeing from the health plan or payer side a requirement for physicians to be e-prescribing and to have EMRs if they're going to participate in the incentive programs for some of the quality programs. There's no question that primary care, family practice, and internal medicine or some of the prominent e-prescribers. We have huge portions, percentages, well over 50–60% of those practices that are e-prescribing. And I think as improved functionality within the EMR continues to grow, we will really see this take off. Think about this for any of us who've been around in the days when filling a prescription and the pharmacy was a manual process with a claim. None of our networks from the health plan would include a pharmacy that wasn't connected electronically. And I would say in the next decade, we likely will see that happen with physicians as well. Next slide, please. We're seeing here, again, just a little bit more detail about the incentives that I alluded to. Medicare obviously was a prominent driver for this with MIPA in 2009, and you basically see the incentive and penalty kind of crossover, and we're literally at the end of the carrot and about ready to transition to only the stick phase. And so this basically meant a 2% incentive on Medicare billings for a particular practice, which is pretty significant. So you can imagine that if a physician was part of a larger group, that group is going to want to make sure they're maximizing the revenue that's coming in. ARA at the same time also provided additional incentive, and you can just see some of the dollars there where we talk about pretty substantial upfront dollars to begin to get in, and for meaningful use. And it's interesting that meaningful use really started relatively modest and has really ended up to be now over 40% of permissible transmitted prescriptions transmitted electronically. Permissible basically is that there really isn't yet a way to do controlled substances. Well, there is, but it's still in its infancy and requires a whole different level of technology. So this is why you're seeing over 44% of prescriptions being transmitted electronically. And if we go to the next slide, with all of these incentives and with all of this growth, really what's the promise here with e-prescribing? And it really breaks into 4 areas. We're going to increase safety, improve efficiency, we're going to increase quality, and we're going to drive down cost. And I think if we think about the reality is that in this country there are about 7,000 deaths a year from medication errors, and that's about 1 every 1.3 hours. There's also 1.5 million preventable adverse drug reactions. Almost 0.5% of hospital admits almost 3% of emergency room visits are due to adverse drug events. And certainly increasing patient safety with e-prescribing by reducing adverse drug events by two major focuses. Number one, reduce the errors from illegible prescriptions. And one can't say enough about the importance of that, and that in and of itself is critical. And then we find that in a system that provides alerts, various drug interaction alerts, other kinds of drug duplication alerts, this also has the promise of reducing adverse drug events. I think it's kind of interesting as we look at this. A survey of 300 docs who e-prescribed in Massachusetts in the Boston area found that 78% of physicians improved the quality of care, and 83% indicated that they prevented medical errors due to this process. So it does seem to work. Improving efficiency, there's less callbacks from the pharmacy. It's actually been quantified to over an hour a day in the physician's office, allows them to spend more time with patients or see more patients, and also better documentation. And I think we get into the quality issue, and Dilip mentioned it. Obviously, there can be a risk to a particular product or could be a potential advantage. As we bring promoting appropriate either drug selection, use, and also detecting and notification on non-adherence to medication, all is a critical part of this quality part. Achieving healthcare savings, there's no question that when alerted that there's lower cost options, that physicians will use that, and that's to the point that Dilip said that this could have an issue with a particular branded product or a particular product from any one individual company. And we're already starting to see reduction in healthcare costs. So outside of the drug itself, there is early documentation of about a half-point reduction in medical and hospitalization costs, even though there was an increase about 0.4% in drug costs due to e-prescribing. So there's obviously opportunity as well as known challenges. And with that, Dilip, why don't I turn it back over to you?
Okay, so just going deeper into this, we're going to show you some very interesting data and charts and graphs. But before we go into that, I would like to understand that the platforms are the ones that drive the functionality of the systems. So you have platforms like Practice Fusion, McKesson, and these are the people who receive the information from PBM and put it into the computers and in the e-prescribing system. So it's very important to understand the role of these folks. And many of them are free, but some of them charge a fee. And the free platforms are the ones that provide drug advertisements to defray the cost of their platforms. And the leading platforms that are in use now, and we found this from our survey, are Practice Fusion, McKesson, Allscripts, Epic. These are EHR-based platforms. And then you have some others like Dr. First, MD Toolbox, Cerner, which is a standalone system. But even some of them are getting integrated with the EHR systems. So as we go forward, we're going to see more integrated systems. Now, I told you before that the PBMs are gaining control of this, and Pharma is kind of upset about this. So they introduced legislation in 11 states to block the role of to block PBM from sending messages, and it is pending in 11 states. 2 states have passed it, New Mexico and North Dakota have passed it, and you know, it is still an open question as to what is really going to happen. So you have New Mexico that has almost fully passed it, and North Dakota that has also passed this legislation. And if this thing is pushed, if there's some force applied to this, and if this thing goes through in many states, then at least the negative effects of e-prescribing will be controlled for as far as Pharma is concerned. We did a couple of focus groups on this topic, and those focus groups are also available to you if you'd like to listen to them. But we find that physicians are becoming more and more comfortable with e-prescribing. In the beginning, there was a lot of apprehension, but now they're good. And they do use the copay offset cards quite frequently. We've seen this, we've heard this, and we've got this feedback from the surveys. So that is being routinely used. And they are willing to see the advertisements as long as it defrays the cost of the system for them. And they love the sample vouchers, they love the e-detailing, and they also like to have that on-demand service that is provided by some platforms. So all in all, the services provided by Pharma are liked and preferred by physicians. So there is room to grow in this area, and opportunity exists for you to take advantage of these services. So before we see the charts, a couple of questions. It is still unclear how e-prescribing will evolve over the next few years. We have provided the answers. We have done a full report on this topic, and there are many different new vectors coming into play which will drive the growth of e-prescribing in the future. We also have information on which new services will become popular, like copay coupons, other services like that. And then interoperability is a big issue right now, where one doctor cannot see the EMR on another doctor's computer for the same patient. But because of leads taken by various platform providers, interoperability will be much more common in the future. The question remains, what is the future going to be holding for us in this area? And we have done a lot of research and provided a lot of good answers in our report, and we'll show you some of those in the next few slides. We've also heard some rumbling to the effect that CMS is going to get active in this. It's going to mandate the use of one certain platform. So what developments come about in that space, we're going to be monitoring that also and feeding you more information on that. And it really remains to be seen in the future if the drug manufacturer's role is going to be growing or will it be sidelined. It is still an open question at this time. So as I said, we did a major report on this topic, and this shows the methodology we used. We did lit search first, and then the qualitative phase with 2 focus groups, one in person, one over the phone. And before that, we actually went and saw some e-prescribing taking place in-person interviews with physicians. And then we followed this with online surveys with physicians, 200 PCPs and 100 specialists. So we have all kinds of data about the preferences of this group from this survey. And then after that, we also spoke to some legislators, some PBMs, some consultants, some subject matter experts to get more information about the survey that we did with physicians to see what their take is on the different reportings. So based on all this, we have a very comprehensive piece of document, and we'll show you some slides from that in the next slide. So in this slide, which is taken from the report, it shows you the overall impact of e-prescribing on persistency. As we can see, a third of the physicians are saying that e-prescribing does increase persistency, and this is seen across the board from all physicians, from the cardiologists, from the neurologists, and so it's across the board phenomena. Okay, this is a very important slide. So as they're doing e-prescribing, about 80% of them decide in advance which brand they decide in advance that they're going to prescribe a certain brand, and then in the next slide you see that the percent of time they decide brands in advance. So this decision is made, and then when the PBM sends the message, it is shaken up, so to say. So here we see that 46% of the physicians change their decision at one time or the other. And they made a decision, they put the name in the box, but then based on the messages, they they change the decision 46% of the time, and 46% of the decision change it, and then 16% of the time they actually make the switch from brand A to brand B. So 16% is quite a substantial number and can have a pretty detrimental effect on the sales of the brand for the company involved. So this shows you the ability to receive e-details and the kind of reaction that physicians are having to the different kinds of exposures that are being given to them through the prescribing platforms. Now, this is the physician attitudes regarding the different services. So this is all physicians reporting, and they're saying that they like the service such as facilitating prior authorization, offering of sample vouchers, adding drugs to the favorites list, subsidized cost of initiation or upgrades, providing copay coupons. They do like these services. So here's the opportunity to provide something that they like through a platform that they use every day and every hour of their practice. Now, this is the kind of information we have in the report for all the services that are provided or can be provided to physicians through the e-prescribing platforms. On the left-hand side, we show the access. So 17% of the physicians can access copay coupons through their e-prescribing platforms. And on the right-hand side, we see the value rating of this service as shown by physicians. So 49% of all physicians think this is and say that this is a valuable service. So whenever there is access is low and the value rating is high, it's a good opportunity to provide this service to them. Sample vouchers, 15% physicians have access to this service, and on the right-hand side we see that 46% of physicians value this service and put them in the top 3 boxes on a 1 to 10 scale. So this is also something that one can bet their money on. It's going to be something that's popular and will give you good returns for the money invested. Now, ordering samples through the e-prescribing platform, the access to this service is low, and the value is much higher at 52% for all physicians. So here again, this is a service that you can benefit from and can provide in the support of your brand. Now, who is using this? On the left-hand side, you see the brands for which patient education materials were provided through e-prescribing EHR platforms. And on the right, we see the same information for copay coupons. So Nexium, Crestor, Cymbalta, Xarelto, Lyrica, Advair, Diovan, some of the leading marquee brands are using these services in support of their brands. Now, drug advertisements are seen for even like marquee brands like Crestor, Xarelto, Pradaxa, Onglyza. So there is across the board buy-in for these services provided through the EHR ERX platform. And the patient demonstration videos are also quite popular through this platform. So as I mentioned before, we have done a study on this, and we can provide you more information on that. But the uses of this study are basically to gain knowledge and to understand intricacies of e-prescribing and how it's affecting the physician. Learn about the competitive initiatives in this area. You know, what is your competition doing? Who is advertising? What are they advertising? How are they doing it? And learn about information being sent by PBMs, and also to gain understanding of the future evolution of trends. For example, the large practices have been laggards in their adoption. but the large practices are now coming on stream. These are practices of 50 physicians and around there, or 100 plus physicians. And once they start to come on, we'll see a much higher penetration of e-prescribing. You can also learn about the services provided to physicians by Pharma through this report and the popularity of the various services. Now going to the right-hand side, if you look at the application, these can be used in the following applications: to present the appropriate information and services to physicians in content and format, to develop counter strategies to what PBMs are doing, and to prepare your marketing plans. I mean, the timing is just right. We're now in October, marketing plans time. So prepare marketing plans to leverage this trend effectively and minimize the negative impact on your products. And there are many additional uses from this effort. So if you'd like to see the brochure on this study to get more additional information, you can send an email to me. The email is shown there, and I'd be happy to send you a brochure. It's dilip.fadnis@alscg.com. We do a lot of work in the electronic space, and if you go to our website, you will see that, and can also send you the brochure on this study for you to carefully look at when you have some time. And with that, we conclude our webinar, and we can take your questions if you have any at this time.
If anyone does have any questions, you can feel free to submit them via the questions form on your control panel in the webinar. That way we don't have to unmute everybody. So if you have any, please feel free to submit them. We'll be happy to answer them. Okay, it doesn't appear that we have any questions coming through, and that's fine. But if anybody, actually, just had one come through. I spoke too soon. So the question is, what companies can you partner with to pay for advertising on e-prescribing platforms? Who are the key players?
Yes, good question. I would say that the platforms like Allscripts and the others that are mentioned in that slide, these are all they're all good platforms. Physicians Interactive is also a good one, and these are the ones to start with to get this ball rolling.
Okay, then it appears that is all for now. So if anyone does have any other questions, feel free to submit while I'm wrapping up here, and we'll definitely answer them. Otherwise, definitely please feel free to reach out to Dilip directly. His email address is still on the screen. He'd be more than happy to answer any questions that might come up. Other than that, though, with that being said, thank you for attending our webinar. And like I said, if you have any questions, please feel free to reach out to us. And actually, here we go. We have another one. Can you talk some more about the legislation regarding e-prescribing? Were the restrictions being placed on companies or PBMs?
Yes, the legislation is pending in 11 states, and we called the legislature of all these 11 states, and the legislation has not been taken off the docket. They're still live, and 2 of them have passed them, New Mexico and North Dakota, and the restrictions are being placed on the PBMs because they are the third party. So the legislation basically restricts third-party messages. And the pharma company, the physicians being the first and the second party, the third party is the PBM. So the PBM messages are blocked through this legislation. So this negative effect on the product usage is being blocked. And actually, the legislation was first drafted and introduced by a pharmaceutical company. Pfizer was the prime force behind introducing that.
Okay. Just going to give everybody a few more seconds, just so give you a few minutes to register any other questions that you may have. Okay, that appears to be it. So on behalf of Dilip and Joel, I would like to thank everyone for attending the webinar and have a great rest of the afternoon. If you have any questions, please feel free to reach out to Dilip. Once again, his email address is still on the screen. Other than that, thank you everybody, and take care.